wonderful meeting, myself and my darling sister Liz. It's just amazing to have you all on here. Thanks for logging on time, and we won't waste too much of your time. I'm Buki, your host for today. I probably will share a little bit about me later, but nothing major, because it's not about me, it's about you guys that are all here. I have Liz, obviously, who's going to be taking most of the presentation, and we have our lovely sister, Dr. Yetty Iriah. She'll come through later on to present some real life case studies, just to bring this home and just show us what mental health is like in real life. So without further ado, I think just as a matter of course, as responsible healthcare professionals, just to say that obviously whatever we share here is for information purposes only. It's not to substitute for your relationship with your doctor. So anybody experiencing any symptoms, your own medical professional is your first port of call. And any products that are mentioned are not intended to diagnose, treat, or cure any disease. I'm now going to hand over to my wonderful sister, Liz Osifo. She's going to introduce herself and carry on with the rest of the introduce herself rather, and carry on with the rest of the presentation.
Okay.
Off you go, Liz.
Welcome, ladies. Welcome. I think there's still some people trying to join in, but that's fine. We can just set off. I think quite a few of the faces that I've seen so far know me, but for those that don't know me, my name, as Buki said, is Liz Osifo. So a bit about myself, because I know Buki also shared a little bio in what she sent to you. I started my journey in mental health in 1994. So at that time, my first child was only a year old. She's almost 28 now. So you can try and, you know, see where I've come from on that journey. It's been a long road, but it's a field that I enjoy, and I've learned quite a lot of stuff just being on that journey. And within that time, I've worked as a senior nurse practitioner, both in the field of adult mental health and more recently in children's mental health. So I currently work as a lead nurse, a lead clinical nurse specialist within the NHS, trying to, you know, navigate the journey with families, providing as much support as I can within mental health. And aside from that, I also am one of the founding members of a group in Hertfordshire, which is a supporting women's networking group called Dinner with Jesus. Although we have the name Dinner with Jesus, we're not affiliated with any specific, you know, denomination or organization. It's just an informal women's networking group where we try and support women within our local community in Hertfordshire. We do a lot with charities, and then we also do some prison outreach work with women post-incarceration. And then I also co-run the Maze, which is an informal counseling and advocacy service with a friend of mine, Dr. Yetty Iriah, who would come on later. So the Maze as well, we don't do any formal psychological therapies. It's very informal. It's a platform where we give you an open space to come on the journey with us. We listen, you share whatever your concerns and worries are, and we try and navigate you through that difficulty. We, you know, do as much as possible to advise, and then we can signpost to whatever we feel will be best. So, and I guess also I've got my hand also in dialectical behavioral therapy, which is something I've done more recently with the young people that I'm working with. So DBT is a pathway that I use as one of the psychological therapies for young people and families, trying to equip them, especially young people who suffer with, you know, quite high emotional dysregulation. So I work with them to try and equip them to be able to, navigate their journey of regulating their emotions and be able to have, better interpersonal relationships with their families, their schools, or in whatever they need to go on to do in their adult life. So it's been a journey of dipping my hands into a few things, but always coming back to mental health and the mind. There's something about the mind for me that, trying to explore how to conquer what I always see as the battlefield of the mind has always been a big thing for me. So this is why the time has come now for me to then bring this into midlife, because I am a woman of midlife. So that's why we're here. So, Buki?
Shall I move on?
Yeah, go ahead.
Okay.
So I guess, as the topic for today, we've chosen to try and, talk a bit about mental health. I'm sure a few of you or lots of you would see now that mental health has become quite a big topic globally. Not just because of what is going on globally, that is, becoming an everyday shock for most people, be it COVID, be it losing loved ones and all that. But it's quite a big thing now. So that's why I thought the time was now to try and talk about this. I know in the past when I first went into mental health, a few of my friends then would say things like, "Gosh, Liz, are you sure you're okay? You must be mad to go into that field," But it is a field that, when you do get into it and try and understand what goes on, like I said, in the mind, it blows your mind. So I guess I try to explore how to, present this to you all, and I did some background search. So I found that 1 in 4 people will have a mental health challenge during their lifetime. If we were in a forum where we're all together and we could see each other, say maybe we were sat in a presentation room or whatever, and I said to people, put your hand up, whoever has had a mental challenge, some people probably won't. And, these are the typical things that we say when they ask those sort of questions, especially in our BAME culture. God forbid, I reject it. It's not my portion. The devil is a liar, blah, 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 blah. And those sort of things are just the responses that we always get. But I've come to reassure you today that yes, we can all have, our spiritual backgrounds, which is paramount and does hold us well, but you need to be equipped and have insight into mental health to know that, there is much more to mental health than just what you think about. Buki, yeah, I need to go back to those stats.
I'm so sorry.
Yeah, is it just moving by itself?
I'm trying to do several things at the same time.
Oh, okay.
Don't worry, sorry.
Okay.
I beg your pardon.
Okay.
Yeah. Sorry, okay. I won't touch it.
Okay.
I won't touch it.
Okay. So I guess it's, about creating that awareness and providing some insight. The current perception out there for a lot of people that, I've spoken to and from what I've seen is that, over time, people have always thought that it's only those that are sectioned or detained under the Mental Health Act or on medications for mental health, behaving bizarrely, in the streets or anywhere that have mental health issues. But nothing could be farther from the truth. So that's, a myth that we have to conquer today with this talk. So as I go along, you'll start to understand this a bit more. So what do I mean when I talk about mental health? A lot of us tend to always try and make the dictionary our point of contact when we need to just look for basic things. So the dictionary defines it as a condition that causes serious disorder in a person's behavior and thinking. So hold that thought on behavior and thinking. And then the National Alliance on Mental Health defines it as a condition that affects a person's thinking, feeling, and mood. Such condition may affect somebody's ability to relate with others and function on a day-to-day. It involves changes in our thinking, in our emotions and behaviors. So if you look at the dictionary and look at the National Mental Health Alliance, you're now starting to understand that it's linked to feelings, thinking, emotions, behaviors. And mental health can also be associated with distress and or problems functioning in social, in work, or family activities. Some of us would have probably come across this with some people that we know. There's a broad range of medical conditions which, are linked to this. Some are, yes, the already diagnosed mental health conditions, but there's others that we need to look at. So the already kind of diagnosed mental conditions that you may be familiar with as major depression, schizophrenia, obsessive compulsive disorder, or panic disorders, and quite a variety of loads more. This list is not exhaustive. They're marked primarily by sufficient disorganization of one's personality, mind, or emotions, and impair psychological functioning. They will cause some of them will cause marked distress or disability that are typically associated with disruption in one's normal thinking, feeling, mood, behavior, interpersonal interactions, or daily functioning. So you can see the correlation with what the dictionary tells you and also what we know of mental health. Next slide, folks. Okay. So I think I delved a bit into the stats before. It's 1 in 4 adults would have this disorder. And when we talk about a mixture of anxiety and depression, which are kind of like the common ones that you will hear about, anxiety and depression has been estimated to cause 1/5 in the day-to-day work in the UK. That's people going off sick because they're suffering from either anxiety and or depression or a mixture of both. And then around the world, there's 450 million people who currently suffer from such conditions, placing mental health disorders among the leading causes of ill health and disability worldwide. So I guess this is a good time for me to say, I think I put it up somewhere, I can't remember, on social media at some point I said, this is when we need to start thinking about physical disorder or physical conditions and mental health being inextricably linked. You need to bring those two together. Gone are the days when you will say, oh, it's only the person that suffers with diabetes or whatever that needs to see a doctor or needs medication. Somebody that has a mental health difficulty needs to be treated differently. No, because both of them now need to be linked in together because, they affect each other. And as we know, the poorer or more disadvantaged are disproportionately affected by comorbid mental health problems and their adverse consequences. So, this would help you to think about, people who have suffered loss of income, who are unable to, feed their families while struggling with whatever is going on for them mentally, loss of income, loss of money. They can't, do the things that they're supposed to do to get their mental health to, the max that it's supposed to be. Okay, next slide. Yeah. So we cannot go ahead without thinking about what some of the causatory factors of mental illness. And the exact cause of mental illness, as far as I'm aware in, my 20+ years of practicing, the exact cause has not been found. We don't know the exact cause, but research suggests to us that there is a combination of genetics, biological, psychological, and environmental factors. So it's not personal weakness or character defect. that would either cause a mental illness or would make one recover from it. So that is far from the truth. Some of the factors that could potentially trigger this poor mental health for us, or, could be things like childhood abuse, trauma or neglect, social isolation, the loneliness, experiencing discrimination and stigma, the loss of a loved one, severe and long-term stress, unemployment or losing your job, social disadvantage, like I mentioned before, poverty, homelessness, poor housing, drug and alcohol misuse, long-term physical health conditions, physical trauma, for example, epilepsy. This can also impact our behavior and our mood. So this takes you back to what I said about physical health and mental health now being inextricably linked. It is important first for us to rule out a cause before then seeking treatments for any mental health problems. Next slide. Okay. In addition to those factors that I previously mentioned, there's also significant life events such as separation, divorce, loss of a husband or a partner, child loss, job or business loss, financial instability, isolation, being alone. I noticed also more recently, I've seen the storyline on, some people that know me know I can be quite an old woman when I want to be, because I like my British soaps. So I watch Coronation Street a lot. And I see more recently, Coronation Street is now bringing to the forefront these issues around coercive control, with Yasmin and her narcissistic husband, and domestic violence and things like that. So these sort of things with somebody like Yasmin now ending up in prison due to no fault of her own, but just because this man has taken total control of her brain, she's ended up in prison. So, you can only try and imagine that scenario where a woman of that age of midlife ends up in prison, and, God knows how she will survive that prison environment. So things like that can, as some of the causes of mental difficulties that we're talking about. Okay. So in continuing to shatter some of the few myths that we've held for a long time about mental illness, I want us to take away from today, if you don't take away anything else, understand that mental illness is not a stigma. It is just like any other health challenge. And I guess as a woman of faith, and because I'm doing this presentation in a non-professional capacity, I've brought some of my faith into it. So, I've put in there what I know from the Bible, which tells me that God has not given us the spirit of fear, but of power, of love, and of a sound mind. So if we take this biblical, example of the promises of God, then it is clear to us that if a sound mind does exist, there is also something like an unsound mind. And I tend to always say to people when I have a conversation that it is a very thin line between sanity and insanity. And when you understand it like that, it brings it home to you. So we must try and remember that for every good thing that God does, the devil tries to destroy it. So that's just the reality of life. And we also need to take on board that mental illness it is an illness, just as it says. It is not a character flaw. One thing wrong with a troubled, sorry, I'm losing my trail. Yeah, so the only thing wrong with that troubled person who suffers a mental illness is that the person is sick. It is not a sin to be sick, and it is not a sin either to be mentally ill. So, sometimes you will hear some of these people who are over zealous or, over spiritual saying, oh, that person must have done something to cause their mental illness, blah, blah, blah. So, going back to what I said earlier on about stigma, we'll come back to it. God does not punish us by making us mentally ill. And he will not heal us just because we pray long and hard enough or we fast long and hard enough. When it comes to a mental health illness, especially a diagnosed mental health illness, there's other things that needs to come into it. Yeah. And as well, for me, I'm 23 holds there in my heart, because it goes back to the promises that yes, we'll go through the darkest valley, and he'll be there with us. Not that the valleys will disappear. Okay. So some of the common mental problems that I've seen in my journey in mental health services, as the two top ones are the ones that a lot of us know. So anxiety. When I think about anxiety, it's a feeling of unease, where we worry, we fear, and then when it goes to the extreme end where you're unable to get past that, that is when we become concerned. So we all suffer from anxiety in our daily life. I had a bit of, G3 legs coming to do this presentation. I was like, am I going to be able to get through this? Other people, it might be they're going into, a work interview. They're like, oh my God. And especially for us women, in midlife, who we've already got a combination of menopause and everything going on for us, where we are hot and cold. So there will be some level of anxiety. But it is when anxiety impacts and debilitates your life that it becomes a problem. Yeah. And then, of course, depression. When we talk about depression, we talk about a mood disorder. A mood disorder that causes you to be constantly in a state of sadness and loss of interest, where it becomes difficult for you to function day to day. And then where it impacts your life so much that you start to socially isolate yourself. And some people, because we tend to weigh depression from the mild to the severe diagnosis. So if you're still at the mild stage, you can still be able to cope with day-to-day life. But when it becomes quite moderate to severe end of things, this sometimes is what leads some people to that point of suicidal thoughts or suicidal ideations, where people start to think that life is not worth living. And we don't want that to happen. And also, we think about panic disorders or panic attacks. So people can suffer panic attacks in different ways. Sometimes I've had women with presentations in front of me where they're constantly having to sip water, because they tell you, they're having the physical manifestations of it, where their heart is beating, so fast that they're struggling to sit still, they're moving and things like that. And health-related anxieties also can be an issue that leads to mental problems. So you can think about, say, people that have had long-term, say, diabetes, arthritis that they don't have a clear prognosis about, and some people even also with chronic asthma. So some of these things can get some people to the point where they have mental difficulties. And of course, other serious conditions which are already diagnosed and established mental difficulties, like schizophrenia, bipolar that I said before, post-traumatic stress disorder. For some people that have, suffered acute and severe stress. Sometimes we think of people that have come from some of these war-torn countries. Sometimes even bringing it back home to the UK, you can think of people that went through Grenfell tragedy. I had to assess and offer treatment and therapy to about 50-something families from Grenfell. So, you know, it's that tragedy that happened. It wasn't any joke. Some people are still suffering the repercussions or the after effects of it till today. Some families are still displaced till today, you know, having to sleep in hotels and things like that. So those sort of things are things that we keep in the forefront of our mind. Okay, so coming down to what I feel this is all about for us, most of us, hopefully that have logged onto this, are women in midlife. And we know that when we are in our midlife, we experience symptoms with decreased hormonal levels. And then the anxiety, like I said before, we go up to another scale. We experience brain fog. You know, I'm having more and more now to write things down. So I said to Buki today, when Buki said, Liz, how do you want to play this? I said, you need to put the thing there where I can actually see it visually and then be able to get my brain back to it. Because I find from 1 minute to the next, when somebody says something to me, I'm having to say to them maybe after half an hour, whatever, I'm like, huh? What was that you said? Even my children are starting to make fun of me now. That, are you sure you're okay? You know, but hey, it is that stage in life that we all have to get to. So brain fog, mood changes. I can go from a scale of high elation to very low mood where I'm like, you know what, my phone is ringing, I ain't gonna pick it. I just need to just be, you know. So we go through those sort of things, and it's because the hormones are playing up at this point of life. And low motivation. So some people that know me, you know that I like to enjoy life. You know, just tell me where the party's at and tell me what you want me to wear. I'm gonna be there. You know, but I'm gonna be there. But I have days when I'm just like, you know what? Nah, man. By the time I think about how I need to get out of this bed and go get a shower and go get dressed and then drive all the way from where I'm at in Hertfordshire to maybe some end of London where this parties are. By the time I think of all that, I'm like, no, let me just pick some nice movie on Netflix and just stay in my bed because right today I don't want to see nobody. So we go through those sort of things, and poor concentration as well. Some of us also have migraines. I tend to, I have personally suffered migraines from childhood, from about the age of 15, and it was one of the things that led to my, you know, prescription glasses. So I tend to on and off have them, and sometimes they are quite exacerbated in midlife. Okay. So continuing with some of the signs, inability to cope with day-to-day problems and stress. Some people just struggle. You know, we are all equipped with some, you know, level of resilience, but we're all different. So we cope differently. Trouble understanding and relating to situations or to people. You know, some people just struggle in every way with interpersonal relationships, you know, making friendships, trusting people and all that. And sometimes this is exacerbated with mental health difficulties. And I mentioned before about alcohol and drug abuse. That's also a major comorbidity. And major changes in our eating habits. This happens a lot to some of us at this stage in life. Sex drive changes, excessive anger, hostility or violence, suicidal thinking. I said before about, you know, when we get to the point of clinical depression, I mentioned before how some of this can lead to suicidal thinking. Not caring about one's appearance to the point where, you know, one starts to look quite disheveled in appearance, when sometimes, you know, you get to a point, for some people that know you really well, if they are worried about you, they will start to ask you that, is everything okay? Liz, you're not your usual self. You know, this is not how you'd normally be, especially when people have known you to be somebody that will always be prim and proper. And then they start to notice things, they will, you know, try and find a way to pick it up. And sometimes the symptoms could also appear as physical problems I mentioned before. presenting in different ways. Sometimes people will come to us and say, oh, my back hurts, I have headache. They will just complain of different unexplained aches and pains. And we as mental professionals, sometimes we would try and explore this more and try and unpick what is going on for that person. Just because sometimes we also have people who present with what we call somatic or psychosomatic presentations. So we try and unpick things to try and support people to get to get the best help and support. Okay, so continuing with the signs and symptoms, they vary depending on the disorder, the circumstance, and other factors. And they all still will affect emotions, thoughts, and behaviors. I mentioned already before about feeling sad or feeling down, confused thinking, reduced ability to concentrate on one task. You struggle to multitask. If you were somebody that was able to multitask before, you start to struggle to multitask. Excessive fear or worry to the extreme, extreme feeling of guilt, putting yourself down constantly, extreme mood change, withdrawal, I said before, social isolation, significant tiredness, low energy, problems with sleeping. There's the bit about insomnia, which is the sleeping, is quite a big thing in midlife because, our hormones is just playing up in different ways. You're sweating 1 minute, and different things are just going on for you. So some of us are having to sleep through the night, even in the winter with our fans on in our bedrooms or air conditioner, depending on which part of the planet you're at. And some people can also present with detachment from reality, delusions, paranoia, or hallucinations. I had a lady once in front of me who came to see me after just having bought a 2,500 pound bag at Harrods. And she brought this into her consultation to show me that this was the best purchase she's bought for the day. So things going on, and then some people, become paranoid when you're talking to them. They're wondering, what are you saying? Who else is there? And things like that. Some people suffer hallucinations depending on, what's going on for them. But these are some of the signs that we look out for. Okay. So how do we take care of our mental health? Keeping everything we've said previously in mind. We need to eat right. We need to eat for the brain. We need to cut down on junk food in midlife. Fast food, processed food, food with a lot of sugar, because those food no longer do us any good in midlife, especially for those of us who, always like to, watch everything that we eat and all that. So this food are no longer good when you get to a certain stage of life. And then you start to think more in midlife about eating for your brain and helping your mental levels so that you're able to function at your optimum daily. You have to eat loads of berries. I mean, I'm sure we know a lot of these things, but just to remind ourselves, we try and incorporate loads of berries, oily fish, wild salmon, mackerel, nuts, seeds, avocados, grains, beans. Some people like dark chocolate. A friend of mine loves dark chocolate. So we eat a lot of nuts, nuts and seeds. And we need to sleep well. Get a full night's sleep. This is very, very important because, we're doing so much work now with, a lot of women and children that are having, loss of sleep. We're doing a lot of sleep hygiene work and stuff. So sleep, I cannot overemphasize this enough. Quality sleep at midlife is important. I know for some of us, we don't get full night sleep just because we have to work different shift patterns, and things like that. And also we have also varied sleep because of what is going on with our hormones. But as much as possible, as much as lies within you, sleep is of vital importance for us to keep us mentally fit at this stage of life. And it gives our brain, you know, what it really needs to get. And we need to also watch our stress levels, you know, because we now need to be more aware of the role of cortisol in our brains. When it is released, it's released when we're stressed. So, and when it is released and we're extremely stressed, we gain weight. It also damages our brains. So we need to try and bring it right down, you know, take a breather, as we say, take a chill pill. If you are in a situation of high expressed emotions, be you a married person or single person, whatever it is that would raise that level of stress for you, or sometimes, you know, our children are driving us mad or whatever it is that wants to get you to that level of extreme stress, you need to take yourself completely away from that situation and then go and bring yourself right down to try and re-regulate your emotions. Okay. Yeah, so as we know, our bodies is our temple. It's a temple of the Holy Ghost, of the Holy Spirit. So we must look after it. We must act promptly. I've had quite a few of GP colleagues, because part of my job also includes me doing a lot of work as a GP liaison for my service. So I have a lot of GP colleagues, and also a GP friend of mine who's actually on this platform wanted me to bring this reminder out there, because GPs are now reporting that, you know, people are not coming to them with these problems. And then when they come, the GP sees them and prescribes, then they don't see them again. So the GP should usually be our first point of call. Obviously, I mentioned earlier on about the informal work that I do. So people like me, I'm very open to people having informal conversations with me if they feel that they don't want to go straight to their GP. I'm very open to that. And if you're my colleagues that I know are open to that. But usually we say, you know, you've got your primary care providers there for a reason. Yeah, you're paying your taxes, you're doing everything possible in the country that you're at, so you need to utilize your primary care provider. Go and speak to your GP. That's a safe space for you to also be able to get a good consultation. And if your GP feels that, okay, this issue needs to be extended to mental specialists, then the GP will come to people like me. Because a few of the GPs, yes, they are trained in general practice, but they are quite good in detecting and picking up, you know, some of this mild to moderate issues. Do things that you enjoy. I've put read because some people are avid readers and they enjoy it. You know, do things that will exert your brain and get your brain going. Exercise, it's another good one. You can exercise for 30 minutes every day. Staying active delivers more oxygen to your brain. You can do it in any way. Some people do Zumba or whatever in their living rooms. Some people go for walks. Do whatever it is as long as your brain is active. Meditation is another one. It also helps to keep our brain in check. Some people would read the word. Some people do play online videos or gospel music, whatever it is that's, you know, works for you, just do it. It's not, you know, we're not restricting this to anything. The whole idea is that your brain keeps moving. And I'm sure, you know, we've seen more recently where there is now more kind of like awareness about dementia and the different forms of dementia. So I've put there about vitamin B. It is great for the brain and can protect us against Alzheimer's and significantly reduce brain shrinkage. Okay, so another thing that we need to take away from this talk today is being our sisters' keepers. I'm hoping we're all women on this forum. If some women are in their homes with their husbands, that's even better, because your husband can also help you to share some of this. So we need to help each other, help a loved one. If your loved one, and what I mean by loved one includes not just your nuclear or extended family, your friends, people in your environment, you know, just care about somebody. Just care about somebody. So if your loved one shows signs of mental health, have an open and honest dialogue with that person about your concerns. Please, 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 when I say have an open dialogue, I don't want you coming to me and saying, Liz, why are you getting fat now like this? Abba, what is the problem now? You were not like this before. Why are you going out of shape? That is not you caring about me. That is you talking down to me and invalidating the struggles that I'm already going through. Yeah, so when I say have an open dialogue, you need to be able to look at ways to reframe and rephrase things. You need to be able to validate and normalize what that person is feeling and affirm them. Tell them that you're there. They might not be ready to talk to you at that point in time, but just show them that you care and that you're there for them. Yeah. And if you're not able to force them or whatever, you can, in your own way, try and probably speak to mental health providers and make an appointment if you can. If you cannot, then, you know, find a way to be able to get through this person. But you must deal with this in a very, very sensitive manner. Because whether we like it or not, especially, like I said, in our African culture or our Black and minority ethnic culture, the stigma is real. It is there. Yeah. And there is discrimination when people want to talk about this. But you need to just keep that space open. And if you find that you are struggling to communicate with your friend or family or whoever, please, I'm here. My door is always open. You can come and have a chat with me, and you and I can try and unpick what is going on, and then we look for a way forward. Or come and talk to us at the maze, you know, that's another, or just give that person my details, mine and Dr. Ria's details for the maze, and, you know, we can just then support the person. So mental illness does not improve on their own, please. If it is left untreated, mental illness gets worse over time and causes more problems. We say to people who come presenting to us with maybe a first episode of a mental illness, and then they then go AWOL or we don't see them or whatever, and then maybe like a year after or a few months after this person represents. Depending on your clinical diagnosis, for each relapse, it becomes more and more difficult for you to navigate that mental health journey. So it's key that you seek help promptly. So in trying to end this, I saw this and it cracked me up. So this is a man just coming back from work, seeing his lovely wife sweating profusely, and he says, "Oh, darling, I understand exactly how you feel. It's been a hard and a tough day at the office." And there she goes. That's her answer. "What do you mean you know how I feel? Like you've had a hell of a day struggling with your moods and your hormones." Okay. So I do hope that I have been able to bring some insight, you know, to us. Knowledge is power, and we need to be equipped with knowledge to be able to navigate not just our mental and physical illnesses, but to be able to navigate life going forward. So I'm going to hand over to Dr. Yetty, who I know has 2 live scenarios for us that can at least help to re-emphasize and bring together some of what I have said earlier to you all. Thank you.
Thank you, Liz. Thank you so, so much. Ladies on the call, please, please, please pop your questions. Please, I know you will have questions. I hope you have questions. So please pop them in the chat. We have somebody moderating the questions. We may not be able to answer every question tonight for want of time, but please, please, please capture your questions in the chat. I'm gonna, call on Dr. Iriah to please, please, please come on And I want to say a big thank you to her, because this is off the hoof. Lastminute.com bookie went to her like 2 hours or 3 hours ago, and she's here to share with us her expertise. Please introduce yourself, Dr. Iriah.
Hello, everybody. Thank you for joining Vibrant Midlife. My name is Dr. Yetty, Iriah. I'm a consultant psychiatrist. I work with children and adolescents, but I've had quite a number of years of practice with general adults as well. So, and myself and Liz work together at the Maze. We have a counseling service in our community. So great. I'm so happy to be here. So thank you, Liz. That was really amazing. You covered everything. Well done to you. So one of the things that Liz mentioned is about stigma. So there's stigma around the treatment, there's stigma around the outcomes, there's stigma around anyone actually who works with mental illness. I know that when I wanted to do psychiatry, people in my family were not happy and they felt that I was going to run mad myself. So there's stigma all around. So today, just to support Liz and what Liz has said, it would be helpful to have some real life scenarios to see how actually treatment and intervention has a positive outcome for people who have mental illness. And so today I have two case studies. So I'm going to start with case study 1, and that is 57-year-old Rosie. Now, this woman, dear woman, suffered, a chronic relapsing course of, depression initially, and then a psychotic illness in her early 40s. I want us to really zoom in on the age, because we're talking about midlife. So in her early 40s, she became ill. Now, like Liz said, mental illness, we don't know what causes it, and there are different causes for different people. But for Rosie, she had marital issues, difficulty, with her husband, and sadly, she lost her first child. I must let you know that Rosie was a solicitor in the city before she became ill. So she was quite a high-flying woman. Now, her family was quite supportive, but they did not seek help early. They looked into alternative medicine, and I have nothing against it. We as mental health professionals, we don't have anything against alternative medicine, against herbs and things like that. But it's not something that we recommend, because we don't have the evidence, and it's not something that we have been involved in or we've tried and tested. So it's the patient's choice to go to alternative medicine if they want, but we will just recommend what we know. So this family dabbled into alternative medicine for a number of years, but things, rather than get better, things went downhill instead. Now, it got to the point where things were terrible, and Rosie would scream all night. She was seeing things in the corner of her eyes. She was hearing voices. She felt she was being followed. And what initially was a period of sadness because of the difficulties in her marriage and the loss of her first child now progressed to a form of psychosis. Now, to make matters worse, her mother, who was her main carer, then died of a heart attack. So things just went out of control. So Rosie started, drinking. She lost her home. She became penniless, more or less, homeless. And in that process of homelessness, she met somebody who obviously must have had some mental illness himself. And he introduced Rosie to drugs, and she was dabbling in different drugs, and particularly cocaine. And still, she didn't seek help. She was kind of just lost in the community until she was found by the police driving on the other side of the road, on the opposite side of the road, on the motorway. So you can imagine, you know, the risk she posed not only to herself, but to other road users. So anyway, she was picked up by the police, taken to hospital, she was assessed, and then she was sectioned under the Mental Health Act, which is the legal underpinning. If people don't agree to come into hospital, we have a duty of care under the Mental Health Act to admit them to hospital. And so that's what we call the sectioning. So she was sectioned and then treated. I think she spent about 5 months in hospital, and then she was then, you know, discharged on medication. But obviously she had no support within the community. She quickly relapsed within a month. She stopped taking her medication, and so she relapsed, and lots of those symptoms came back again, and even worse. Then she was sectioned again, and this time she was in hospital for about 9 to 10 months or even more. And then at the time she was discharged, they decided to put her on a depot injection. So a depot injection essentially is the injectable form of the tablets we will prescribe for mental illness, particularly for psychosis. And one of the reasons why people are given the injectable form is for compliance. So, you know, rather than take a tablet 3 times a day, they have just one injection, maybe, you know, fortnightly or monthly. Some people have them, you know, 3 monthly, depending on the type that's being prescribed by the psychiatrist. And so she was discharged on a depot injection, and she's managed quite well within the community. She's been compliant with her depot injections. She has a key worker who reminds her when she's meant to have these injections. She currently lives in supportive housing, and she volunteers, you know, twice a week for the local mental health charity in her community. Now, you can see I wouldn't want to call it a negative outcome, but you can see that this is an example of, you know, a long protracted illness. So this lady now is 57, and she started getting ill in her early 40s. And in psychiatry, we have what we call DUP. So DUP stands for duration of untreated psychosis. And research has shown that the longer the duration of untreated psychosis, the poorer the outcome for the patient and for their families as well. So what would have been a short intervention, you know, with therapy, with, you know, plus or minus medication, has now, you know, become a prolonged illness with kind of almost like a poor outcome, because you can imagine she was a high flyer in the city, and then because she didn't have the help early, look at the way her life has turned out, you know, and it's such a shift for her. She has very little contact with her family, and things are not the same at all. So that is the reason why we always advise that you should seek help early. So the next one, Buki, yes. So we will end on a good note today. So the case study 2 is about 55-year-old Laura. So this is somebody that I treated quite closely over a long period of time, almost 10 years ago now. And she had a 2-year history of, you know, initially low mood and anxiety, and depression and anxiety kind of go hand in hand in most cases. And so her diagnosis at the time was mixed anxiety and depression. And for Laura, she had some setbacks in her, you know, in her mid-40s. For her, it was mid-40s. She had been married for 23 years by then, and she lost her marriage. Her husband was, you know, having affairs. You know, there's something about about women in midlife and men. I don't know what men are doing to us. So again, she lost her marriage of 23 years. And then, you know, sadly, you know, she lost her income. She was working in the airline industry at the time. She was working part-time and with the plan that she was going to retire at age 50. Her husband was quite well-to-do and was supporting her financially. And so with the breakup of the marriage, obviously the loss of income, the loss of the home, she had to downsize, and she became very sad. So she started off quite well. She went to the counseling service in her local area. She attended counseling for about 2 months, but then things were kind of going downhill. So there's something about just being sad about what's happened to you. But then things can progress to the point where you're not sleeping, you're not eating, you're losing weight, you know, you're finding it difficult to remember things. And she was making quite a number of mistakes at work. So the counselor then advised her to see her GP, which is the normal thing. So she went to the GP assessed and then referred her to psychiatry. She was seen and she was put on some antidepressants and then started with CBT. We call that cognitive behavior therapy, where we look at how your thoughts affect the way you feel and how the way you feel in turn affects the way you behave or the way your actions. So that's what we call CBT. So she had the standard 20 sessions of CBT on a weekly basis, and then she had 4 top-up sessions privately on her own at the end of therapy. And at some point, she also had interpersonal therapy, which is what we call IPTs, another kind of therapy, which they felt would have benefited her. So she was on her antidepressants for 2.5 years. One of the things that we recommend for those people who have depression is that they continue on antidepressants until they have at least a year of stability. And then the GP can, or the psychiatrist can, you know, carefully wean them off. So for Laura, she was on antidepressants for 2.5 years, and then she was weaned off over about 4 weeks. The outcome for Laura has been wonderful. She's been medication-free. At the last time I saw her, she had been medication-free for at least 3 years. She went on to retire at 52, and she now runs her own flower business. She's found love. She had found love again, and she's now a grandmother of 2 lovely boys. Now, on a personal note, I ran into Laura just before she retired. I ran into her at Heathrow Airport some years ago, and she grabbed me and she said, "You know what? I'm going to upgrade you." She took me straight to the to the checkout and said to somebody, one of the crew, "This is my GP. Please take care of her. Put her on first class." And then she whispered to me, "You know, I called you my GP because I don't want anybody to know I had mental illness." And we just had a laugh about it. So, you know, she was doing very well. So this Laura is a perfect example of the many ladies in midlife who sought help early, got started the right way, got the right help, accepted the help, admitted that she was struggling, named the illness, wasn't in denial, and she sought help, and the outcome for her was excellent. So another thing, I'll just quickly chip in, and Buki, is very important that you are bringing this mental illness session to us at this time of our lives, because midlife can be quite lonely, with the children leaving home and so many things happening to us. Some of us are losing parents at this time, and we don't have that kind of structure and support that we had growing up, you know, earlier on. And then when you now have a mental illness, suffering from a mental illness in itself can be very lonely. People tend to shy away from you. So, you know, you don't want the combination of a mental illness and midlife together. It can be a very terrible combination. And so that's one of the reasons why we always advise seek help at the earliest sign that something is going wrong. Thank you very much.
Phew. Thank you, Dr. Iriah. How do I say your last name?
Iriah.
Iriah. Thank you, Dr. Iriah. Thank you, thank you, thank you. I guess you and Liz have gone before me to say everything that I possibly want to say. But as everyone will know, I am a person of action. So I want us to just take a moment to think about what we've heard. And let us not be the sisters that just hear everything, absorb this information, and do zilch. Because the time for doing zilch, there is no time for doing zilch. I also want to point out the body-mind connection. Liz alluded to it before. What a lot of the prevention strategies for mental health situations are all lifestyle related, and that's where I come in. So please, be the sister that takes action. If you need to pick up the phone to call Liz, we will call Liz. If you need to have a referral, you will have a referral. If you need to look after your sister because you feel she's acting strange, look out for your sister. At this point in time, we have all sorts of things going on in life. We've seen the slides, but we can help ourselves and we can help each other. So when I then talk about action, we can't take action if we don't know what to do. So my work and my job here is to find the resources, to provide the resources, to provide the support, to provide the accountability to help women at this phase of life. So Liz has said it, your first port of call should be your GP. That's the professional service, that's the healthcare professional. So that should be the first port of call. Who would most likely, if it's a mild thing, they may be able to deal with it, but if it's something that needs referral, we'll go to the next level, which is secondary care. The maze, Liz touched on the maze. The maze is there, Liz and Dr. Iriah's counseling and advocacy service. It's open, available. We will share the details with you. There are other charities out there. There's Mind, which is, Mind is it's an amazing charity. They have websites. That could be your first port of call. They have support helplines. It is well manned. I've just become aware of another mental health charity specifically targeted at Black and ethnic minority people called Black Minds Matter UK. So you can check that out. And United Christian Broadcasters, which is UCB, have a helpline. So this list is not exhaustive, but it's what I have come up with. When we look into lifestyle management, that is my forte. That's what I'm thinking, let's prevent the sickness before we get there. Let's prevent, and it's not about coming away from illness, but it's looking towards wellness. Let's be whole, let's be well. And so when we talk about the mind, I have a couple of products. I'm going to just flip this screen. What I've done is researched some products that I would take myself. These products are plant-based. And so there's one called Mind Health, which supports cognitive function. There's another called Inner Calm, which it has a compound called, it's an adaptogen. It's called ashwagandha. Ashwagandha is a natural product that helps to relieve stress. So these are our products for the mind. When we come to weight management, we have this product here that's called Full Control. It helps you feel fuller for longer. So obviously you're reducing your calorie intake. And then it's combined with a product that helps with metabolism, because at this phase of life, as we lose estrogen, weight somehow just comes on board, and we need to be mindful of that. You heard when I think Liz did present that when we have a mental illness, invariably it comes along with weight. Some of the medications that you take when you're on if a person is diagnosed, actually have weight gain as their side effect within their side effect profile. So it's just to make us aware of that. Liz touched on supplements. A good quality supplement to help. It's not to replace your diet, because ideally you should be getting all of what you need from a wholesome, whole food diet. But if you need good quality supplements, again, plant-based products, because typically that's what God intended for us. Our foods typically should be vegetables. And I'll just go back to that first slide. Yes. In terms of lifestyle, because people will be thinking to make lifestyle changes, it can be quite tedious. You know, first of all, you have to shift your mind. You have to think, okay, what am I going to do? So for that purpose, we've come up with a reset program that will give you a diet, that will give you a plan, that will give you menus, that has coaching associated, just to help you. That's within the Vibrant Midlife community. If you want any information about that, I can make that available for you. And so my Nigerian sisters say, I don't like to eat broccoli. I don't like to eat asparagus. I don't like to eat sugar snap peas. So what I also have gone ahead and done in order to help support our weight management situation is created a meal plan of 30 Nigerian dinners. I beg your pardon, I had to start my charity at home. So they are Nigerian dinners, but they will evolve into Caribbean dinners and will evolve into Ghanaian dinners. But what I did was work with a certified dietitian to say, I need concise meals of a certain amount of calories that people can take as dinners. And I can tell you, we started the 30-day program, myself and 6 other ladies, middle of July. Honestly, it's been an amazing program. There are ladies on this call who are on this program. Within a week, some people are reporting 2 kilogram loss of weight. And I'm not selling it as a weight loss program, because that's not the intention. My intention is your reset. Learn how to eat the right foods that support you at this point in time, have structure, have support, have accountability, so that it will serve as a launch pad for you to move forward. So yeah, we have the meal plan available. Again, it's a concise plan. Within our reset program, I'm conscious of the fact that if we talk about food and diet and nutrition, if that's not combined with exercise, and the right sort of exercise for this phase of our life, exercise just enhances our results. And as Liz said, it gets oxygen pumping to your brain. It's one of the things that we must do at this phase of life, like it or not. I can't stand exercise, but I have to drag myself out every day to get moving. So yes, I also have come up with 4 videos specifically targeted at women in midlife. So they're low impact. There's cardio, there's abs, there's bums and legs. Again, working with a fitness professional, because I know my strengths, and I wanted to work with people who are qualified in particular areas. One of the things that I always say as well, in terms of stretching, at this phase of life, people will recommend stretching. Stretching comes in different forms. So you would hear possibly yoga, you would hear Pilates. For me, I stick on the Pilates lane just for my own reasons. There are a couple of Pilates ladies that I follow on on YouTube. So Rachel is, she's called the girl with the Pilates mat on YouTube. And what I like about her is she has little bite-sized beginner programs. They're 10 minutes. You can just do that, stretch in the morning, off you go. And what you find with Pilates is it helps you build muscle strength, which we need, and it helps your core. So those of us that want flat abs, that's a way to go. I also then came across, because I'm thinking, this Pilates, is there no black lady? Let me find a black Pilates instructor now. And there I went and I found this lady called Iriah, and she's got amazing workouts on YouTube as well. So those are a couple of people that you want to follow. I love to dance. And so again, and dance is a very, very, very enjoyable form of exercise. So there's a young lady called Rachel. Her YouTube name is, I think it's Afri Fitness. And she just bops to Afrobeat. It's just so cool. So again, that's something that you might want to check out. And then we have Lisa Sanson. Lisa Sanson is, she's AHA certified. So AHA is the American Heart Association. And what she does is specifically walking. And walking for us at this stage actually is a tremendous form of exercise. If you can catch in 10,000 steps a day, just without thinking about it, you will begin to see the weight drop. You begin to see the tone that you're looking for. So Lisa Sanson, why I advocate Lisa Sanson is for those days when you look out of the window and think, oh my God, I don't want to go out today. You pop her on YouTube, you beam her to your television, and in your living room, off you go doing 3K. So we really don't have the excuses. So if any of the things that I've said resonate with you, if any of the things that I've said, you think, okay, I want to take one step today, please pop whatever into the comments, please. But what I just want to encourage you, my sisters, please do not leave this place and not take action. Do not leave this place filled with information and no action. We must, resolve to take one step that will take us closer towards our wellness vision. Do I have anything else to say? Yes, I do have more to say. When it comes to other resources that we've come up with, I am well aware that the shift that needs to happen is in our head, between our two ears. The Bible says, be ye transformed by the renewal of your mind. When that happens, which we get by the word, when we meditate on the word, go and find out, what are the scriptures that support? Do I have a healthcare condition? Do I have a health condition? What are the scriptures that support the condition? Do I have do I just feel that, you know what, I just want to speak and pray and into my well-being? Find the scriptures, say the scriptures, meditate on the scriptures. I am a firm believer in affirmations. So in lockdown, we thank God for time, I've come up with 3 affirmation booklets. They are available on our website, vibrantmidlife.com, and they are available as free downloads. One deals with anxiety, because I recognize at this time that a lot of women at my stage of life, be that within my own networks, on social media, everything was panic mode. And I thought, you know what? So I penned this booklet for that purpose, to give, if you speak peace and calm into your situation, that is what it will be. I have affirmations for Vibrant Midlife, and that covers 6 domains of lifestyle medicine. So sleep, substance, nutrition, and it's just speaking the word, and each of these have scriptures. And then I recognize, obviously, COVID-19, where people are losing people are losing relatives. There's a lot of grief, there's a lot of sorrow out there. So this is an affirmation booklet speaking to grief and sorrow. Liz talked about meditation, and I can't recommend meditation highly enough. I know people who have said that meditation has actually taken them out of depressive states. And I'm not saying it's treatment, but that has been my reality. So the Soul Time app is a Christian meditation app, and it covers different domains. Check it out. It's on Apple Store, it's on Apple, and it's on Google Play. The other thing I would just say is get connected. Loneliness is a big precursor to mental illness. Get connected, and speak to people. If you have a problem, don't bottle it up. Don't Sweep it under the carpet. Don't bury your head in the sand. If you know somebody that does, speak on their behalf. Be a friend. If you're friendly, you will have friends. Don't let us not be loners. And so even if, okay, you think, okay, I don't want to network within the ladies that I know, I don't want to network in church. If you have a passion, seek out meetup groups online and just connect with other people. There are so many opportunities for connection these days. So let's not be alone. That's it. I think also, sorry?
We have 1 or 2 questions. I've sent them to you.
Okay, not a problem. Just bear with me. I think Pastor Mobs, it will be useful for you to you don't mind if you verbalize those questions. That's not a problem. I wanted to say, Dr. Iriah spoke about herbal medicines, and as she said, a lot of what I do within lifestyle medicine has to be evidence-based. You follow the science, you follow the literature, but some people do. They go the alternative route. They want herbal medicines. If you do want to seek out herbal medicines, there is a regulatory body. It's called THR. THR is associated with the MHRA, which is the Medicines and Health Regulatory Authority. Any herbal medicine that has a THR marking has passed through regulation, will have relevant information, so you can read a leaflet and assess whether you take that medicine. So that's something I wanted to share. Also, within our midlife and all of the symptoms that we recognize, the anxiety, the brain fog, create your own strategies. I remember, some of the past contracts I've done, we will sit at a meeting. It will pass through here and just pass out of my head. And I thought to myself, okay, and then someone will ask me a question and I can't come up with the answer. So I had to come up with my strategies, because when it starts to affect our work and stuff, we start to lose confidence. So, and my strategy was, as Liz said, I just write it all down. I just make sure I take my notes. My notes are concise so I can go back and refer. If I can't write it down when I'm in a meeting, I put on my phone and I record. So I can go back and play back what it is I need to find out. Because it happens just as naturally. And we shouldn't be in denial, but then find mechanisms to help us cope with these things. I think that's it, really. We'll move into question time. We set up this meeting till 8:30. If you want us to stay beyond that, if questions take us beyond that, that's perfect. If not, we'll capture as many as we can in the time that we have, and then we'll reach out, we'll look at through all the questions and provide answers via, social media, via whatever. So I think before we go into your questions, I asked a question. I think I sent out numerous messages saying, all of these talks that we have planned, it's fine for me to have plans for talks to give, but it will be useful for you women to share with us, what is it you want to know about? So please, can you dip your thoughts into the comments? Just tell us, future talks, what do you want us to address? Topics that relate to women in midlife. Please go, because we won't move to Dr. Iriah's questions until you answer my questions. Please let us know in the chat. Oh God, the chat's buzzing. Okay, great. Yes, you will have a recording of the session.
Do you want us to wait for the question? And someone has...
So I want people to, I would like people to capture topics first, and then we can go into the questions. So 2 minutes, please, ladies. The sooner we have those, I'm sorry, I have to hand you to ransom, because if I don't, please just pop some topics in there, and then we can go. Okay. Please, please just pop some topics in there. Just one or 2 more minutes, and then we go into Dr. Iriah's questions. Pastor Moss, please handle the questions. That's fine. And whatever we don't capture, as I said, we'll provide answers to later, because I have a recording, and I personally sift through it myself and provide answers to people. So rest assured, you'll get your answers. Okay, Pastor Mobs, take it away.
Good evening, everyone. Sorry, I can't show my video. It's, well, anyway, don't worry. My voice is good. We don't have a lot of questions, but we have a lot of ideas that people have put there regarding your questions that they would like to hear about.
Okay,
but
cool.
I'll read the question. Is there a direct link between menopause and mental health? Did you get that?
Yes, I did. Who is the question directed to? Who asked the question and who's it directed to?
Right. I think it's Sister...
I think Yetty can take
Sorry,
it.
I asked the question.
Yetty, yeah. Okay,
Yetty can take
Dr.
it.
Yetty can take it, yeah. The book has been passed on to Dr. Yetty.
Thank you for that question. There is a link between the menopause and the and mental illness, in the sense that, like Liz mentioned earlier on, we go through a lot of hormonal changes. And so the hormonal changes alone impact on our mental health. And one of the things that is quite common is the loss of memory. I'm sure a lot of us who are mid-40s, early 50s and up have been noticing lapses in memory. So that is one of the things that is quite common. Then secondly, anxiety is another thing that is quite common, because as we age, we tend to produce more cortisol. And if we put this side by side with all the other changes that happen around midlife, like I said, change in your social circumstances. Some of us are leaving work, some of us are retiring, some of us are looking after elderly parents, some of us sadly, are losing loved ones or our spouses, God forbid. So it's a very trying age for most, particularly women. Men tend to manage much better than women, because again, you are aging, you're not happy with the way your body is looking. Some of us are losing our hair, and there are lots of things that you don't feel comfortable with. So there's lots of anxiety and also fear for the future. And so if you notice that you're experiencing any of these things and you feel that they are getting out of hand, then you should seek help. So yes, there is a link between the menopause and mental illness. It's not a direct link, it's an indirect link through other processes.
Great stuff. Thank you, Dr. Yetty. Pastor Mobs, next question. I'm sorry, Dio, did that answer your question?
Yes, it did. Thank you very much.
You're most welcome. Thank you. Pastor Mobs.
Yeah. Okay, the other questions are just, I think people wanted to repeat the Pilates video link. If you can send it back again, I think some people were writing down in the
okay, cool. Okay, I'll put that in there.
And also the fitness video.
The fitness video I will send out. The fitness video is Vibrant Midlife property, but I will send that out. Obviously, I hope you all registered to come into the meeting. If not, you miss out on our messages. But yeah, otherwise, please follow us on social media, because you will find Vibrant Midlife is just easy. Facebook, Instagram. But yeah, I will share the fitness videos with you latest midweek, Wednesday. Yeah. So Rachel is girl with the Pilates mat.
That's all the questions on
so
here.
That's the first person. And Isa, ISAWELLY, both on YouTube.
Another question.
Okay.
This goes to Liz.
Okay.
Is mental illness hereditary?
I think I mentioned before about it's been a combination of different factors. there is some research that has shown that there is some genetic elements to it. And I guess over time too, when, you know, some of us in our journey, when we've worked with some families, we found that, you know, we end up nursing, the mother comes through our service, then the children come through our service. And so there is some genetic elements to some of the kind of like diagnostic pathways that we do get through, but it's not solely everything that we do for us to get a clinical diagnosis. We don't do it just solely on the genetic elements. So there's other factors like the psychological that I mentioned before, the social, you know, so we take into consideration all the different elements to it and kind of like form a care formulation that way. But there is a genetic component to mental illness, yes.
Okay, thank you very much, Liz. Does that answer your question, Dupe?
Yes, that's fine. Thank you.
Thank you. Okay, there's another question here. I'm not sure who's going to answer it, either Liz or Dr. Yetty. Is there anything that can be taken for low cortisol, like vitamin?
Buki, do you?
I'm not aware. No, seriously. I don't know any. Temi, are you online?
I think it's a combination of what things that we put up before about eating right for your brain and those sort of things. I don't think there's just a particular vitamin that you would take that will help you with your cortisol.
Cortisol level. Or
Yeah.
let me take that question away. The other thing I would say is, rather than think of what to take for cortisol, is think of what do I take to minimize, what do I do to minimize my stress?
Yes, that's it.
Mm-hmm. Yeah.
To manage my stress, to minimize my stress.
Yeah.
So if this is one of the things that I do. Women in midlife, you get to this phase of life and you have so many hats you wear. With the many hats come many various functions. With the various functions comes a lot of commitments. And so one of the things is prioritization. Do I have to necessarily be at any function? Can I RSVP to certain functions? Can I go ahead of time to sit down with my girlfriend who is celebrating that birthday and just give her my gift and tell her, you know what, Saturday I'm not available, but Thursday here I am, one-on-one with you. Let's have some good quality time together.
Yeah.
We juggle so many things. Am I in a toxic relationship? Some we can walk away from, minimize your stress levels.
Yeah. And I guess just re-emphasizing again about, you know, that logo that, what's her name? This famous girl, God bless her soul, she said about being kind to ourselves.
Yeah.
So it's about, you know, it's okay not to be okay.
Absolutely.
Because at the end of the day, you don't owe nobody nothing. The person that you owe everything to is you. So just always think about number one and put yourself first.
Yeah, absolutely.
It's okay not to be
No,
okay.
I hope that helps. Pastor Mobs, any more questions?
This one, I think I know the answer, but I would like it to come from you. Somebody wants to know if you can email them the different dietary food that can be eaten, including the African material ones, to help maintain a healthy diet and lifestyle.
That's in our book. It's in our ebook. Definitely, I will email that to you.
Okay.
That's not a problem. It's a link.
Yeah.
So I'll send the link to whoever, and you can go ahead and get the book. Please do. Yes, that's not a problem. And I will have the chat in here, so I'll be able to find out who's asked the question. It's come through the chat. Yes.
Yeah, it's Lola.
Okay, cool. That's fine.
I think there's a lady here asking for ladies to share what has helped them in their journey of menopause and midlife.
Okay.
Fola Alex, Pastor Mobs, can you see that?
Yes, that's me.
Yes,
Okay.
yes, I can see it now. Yeah.
Okay.
Yeah. So thank you.
Okay, that's fine.
I want Dr. Yetty to go because she went into menopause way before any of us. Dr. Yetty, is she still there?
So Thank you, Liz, for exposing me.
For those that didn't know, Dr. Yetty went into menopause in her late 30s.
Oh, wow.
Wow.
I
thought I went early.
So that's why I need her testimony today.
I went into menopause at age 35.
Wow.
And out of the blues, you know, I was, you know, having all the hot flushes and all the stuff that you have during menopause at 35, and I was going crazy. And I went to different hospitals and everything, and they said, you know, did all the scans and blood tests, you know, short story, you know, that I couldn't have children anymore. And then for some reason, through, you know, I'm a woman of faith, within a year of going into menopause, I got pregnant in the menopause without going for any IVF or whatever. I got pregnant in the menopause and I had a set of twin girls.
Wow.
And when those twin girls were 1 year old, I went back into menopause.
Oh my God.
And so I've been in menopause now about 20 years. And you know, this menopause journey is quite, can be quite horrendous. So all the hot flushes, the loss of hair, I have very little hair on my head now, thank God for wigs. The loss of hair and all the other things that come with it, I've gone through all of that. But it tends to happen, it tends to last for about 5 to 10 years. So I've gone through that dark tunnel and I've come out on the other side. And I haven't had any of those symptoms for quite a while now, for a number of years actually. And one of the things that I was, my GP considered prescribing for me was HRT. But then we had to think about the risk of HRT. I know Buki is thinking about bringing a session on HRT in one of her Zoom meetings. But one of the risks of HRT is cancer, particularly of the breast. So they looked at all the risks and they felt because I was young, I could just manage without the HRT. So initially I used to take oil of evening primrose and vitamin C. And I took that for a number of years and I still take it now off and on. But there are a lot of other things that are currently being prescribed by GPs for the menopause. There's an antidepressant called venlafaxine. Now, venlafaxine is an antidepressant, but it has some chemical structure that has been found to be helpful in reducing hot flushes. So quite a number of my friends have tried venlafaxine and have found it quite helpful. So if you go to Holland and Barrett, you would find quite a number of remedies for the menopause. Most of them are quite effective, but for me, I just stuck to my oil of evening primrose and my vitamin C, and I just, you know, kept a wet, slept with a wet face towel on my chest all night and opened the windows, and I just managed to get through it. And it is a very difficult time.
It is. Wow.
So one of the things that not one of the things, but some of the things that I have done is I use cotton bedding. That's one thing. And it doesn't have to be expensive cotton bedding. Sometimes I just use Ankara sheets to cover myself. I sleep with a winter duvet, summer duvet, 4-point duvet all year round, because I can't cope with anything heavier. The window must be open. There must be air exchange even in snow time. That's just some of the things that I've used to manage myself. Obviously summer, if you can get the portable air conditioners, if you live in the States where you've got air conditioning, or if you live in Lagos where you've got air conditioning, that's perfect. But here you can get portable air conditioning, you can get fans for the heat. Hello.
Hi.
Yeah. So yeah, those are some of the things I've done. In terms of, I've shared about brain fog and concentration and forgetfulness. Joint pains, vitamin D, so crucial. And I know I used to have one terrible elbow pain, and I can tell you that pain disappeared. I tried medication, I tried everything. That pain disappeared when I started taking green smoothies, and I'm sharing on my Instagram the recipe is there because it was so effective. So these are some of So yeah, those are some of the things that I have done.
Hello. Okay.
Pastor Mobs, I think you've muted me as well.
No, you're on. You're on.
Does anyone else have any tips they'd like to share with sisters?
I just did, actually.
I just have one. Sorry.
Yes, please. Please.
I don't know whether, because we've got a lot of medical people on board. Well, when I started because mine was induced at, was it 40 or 39 thereabouts, when I had hysterectomy done. It was, yeah. Was it when I had it? When I had hysterectomy done, then about a few years after, I had total hysterectomy. It was partial one that they did before because it was cancerous. So I went fully into menopause early. So somebody advised me, because I couldn't take, because I've had, what is it called? Blood clot as well. So there's no way they're going to send me towards HRT. So I was advised to take menopause. And it was really good. I took menopause and it was really good with a lot of exercise, and I changed all my diet. Right. So very healthy diet. I feel like I know that with exercising, running or exercising at home has really helped. I still struggle a bit with the tummy bee, but I do a lot of tummy exercise just to keep my mind going, because you need to exercise discipline on your mind as well, to keep your mind busy as well. I forget things a lot. So I write things down, like you said, I write everything down. And I tell my family the way I'm feeling so that they know. So yes, menopause was what I use, and a lot of exercise and healthy food. Good. Really, really healthy food is very good. All those oily things will not help at all. Drinking fizzy drink will not help you at all. So yeah, for me, it didn't help. I don't know whether the doctors in the house can.
Yeah, sugar is
an enemy of this thing.
I'm telling you. I'm conscious we've run out, we've run over. If you're happy for us to still stay on, fine. We can continue with more questions. However,
we have another question very quickly.
Okay.
Can we please mute ourselves, please? We're not talking. Please. Thank you. Somebody asked another question. Can you advise on mental illness in Nigeria as well? Because they don't live in the UK. They live in Nigeria.
Okay. I'm just wondering what specifically they're asking.
Mental illness. Oh, well, yeah, specifically. Please, could you ask what exactly you want to know about mental illness in Nigeria?
Yeah, because why we're asking that is because there will be, or there is, I'm aware that there are mental health provisions in Nigeria. So we need to know what exactly the specific question is.
Okay. They've not put specific questions here.
Do they want us, are they saying they want us to link them up with mental health providers in Nigeria? Is that what they're wanting?
Bimbola, if you're still online, could you please say something? Do you want to be linked up with someone in Nigeria, or is there a specific question you want to be answered, please?
Okay, yeah. For me, can you hear me?
Yes, we can hear you clearly.
Yeah. The way we view mental illness in Nigeria is different from the way you view it in London.
Okay.
In the UK, you get.
Okay.
Here, once you say you are mental, they think you've completely gone mad.
Okay.
There is a doctor, Dr. Memuna. I know.
Okay. You know, but from what I've read, I've done some research. Your mood swings and all those things, they're all parts of mental illness. You get what I'm saying? So we need to educate people here that it's not being going completely mental. Your hormonal differences and things like that are all contribution, and how you can sort of help people to know that this is what you're supposed to do.
Okay.
Because what you have there is not what we have here, because your medical thing, your medical setup is completely different from ours. We are at our own. We have to do our own research to keep our life by educating ourselves and reading and knowing what to do.
Sis, Bibola is my senior sister. She's Mrs. Organ. She's my big sister. Sis, I do know that there's a Dr. Maimuna in Nigeria. She's big on mental health. I will find you her details and I'll send them to you. But then if you want us to put on a mental health talk for women in Nigeria and you gather the crowd, we will definitely do that. That's
I think we should do that. Yeah. So
I'll liaise with you separately. Okay, but I'll find Dr. Mimuna's details and I'll send them to you too.
Okay. I think just to add to that, sis, we can certainly do that with what Buki said, but I'm just curious as to when you started, you said once you tell them that you are mentally ill in Nigeria. So I'm almost immediately starting to think that the language that is used.
I didn't say that. What I'm saying is that the way we think of mental illness in Nigeria is different from the way you view it in the UK.
Yes.
Okay.
Okay.
We go to the extreme, but you start from the initial part. Your hormonal, your hormonal difference. Like I remember when I started my menopause, I went through a lot, but somehow it just stopped. And people react to menopause in different ways.
Yes.
Like now I know that your hormonal, because then I didn't even know, because I had all sorts of experiences and it was strenuous for me, but after I got over it, it was over. But now I have younger ones coming to me asking for advice and know what to do. But people, our body composition is different from each other.
Yes. I get what you're saying. It's important that we educate
them
people
to know,
because mental illness is just a spectrum. It's so it's important that the education is key.
There. Yeah. And I don't know what really we have here in Nigeria. I don't think we really have as much as you have. Like you say, you go to your GP. Go to your GP, maybe he will refer you to Iriah or something, or tell you. I remember very well during my menopause, I just had this constant headache. It went on for weeks. And he put me on, and I said, doctor, what's the problem? He said I had migraine. I said, how can at my age have a migraine? He said it's possible. But he put me on some drugs that were dangerous to my health. But thank God my husband came to my rescue. And things just went off like that.
Okay.
So definitely we'll.
Okay, I've got a friend. Ayatollah has just put up that there are a lot of private mental health provisions there, and it's about raising awareness. So, which is a big thing that we do take on board. I'm sure Buki would liaise with you, and we can sort out if we need to do something specifically for raising that awareness amongst the community there. With your guidance, we're happy to do that.
I'll be willing to help you, whatever it is, at least. I'm retired now, so I have time to join you.
Okay, so Buki would let Dr. Yetty and I know about this, and then
we'll circle back to you.
Yeah.
Thank you.
Thank you.
Hello, Kathy is raising up her hand.
Yes, please, Kathy, please go ahead. Can you unmute Kathy, please?
Yes, I am unmuted. This is Kathy Adu, and I'm calling from Antioch, Illinois, here in the States.
Yeah, most welcome, sis.
Yeah.
don't you all start.
That's my family right there.
It's really a comment, ladies. And I live in, as I said, the States, but I live in the county of Lake County up in Illinois. And there was a push last year, and dollars were spent because I did my research, and I was also part of that pilot. But there was a serious push, like they knew COVID was going to happen, but I'm sure they didn't, but the county spent money and just had volunteers. So they trained a set of people. It happened in the library, and they pushed out a training. It was a 2-week training, and you got a certification. And what was this about? To recognize mental health in your family, a man on the street, and to immediately take charge, part of your civic duty, to help out. So there was a great push. It was a great push. It wasn't, it was something they'd been thinking about, but just, you know, picking people systematically within the community, like your everyday Joe, to be mental health first aiders. That's what we're called.
Yeah.
And it armed us with recognizing the symptoms, what to say, what not to say. Like Liz pointed out some things, sometimes you just have to listen. And it was a one-on-one training, and just a very simple, basic book to follow. But it gave me an insight as an ordinary Joe. Yeah. So I had that under my belt. And it's something like what you guys have just started right now is awesome. And we don't have to wait for the government to, you know, to push. We're at home, we can use Zoom, but it's just pushing out this information, which you ladies have done. I have been looking at the amount of people on the call, 72 people in one day. That is a lot of ears. And all of us can now go out and, you know, we can recognize what is happening. And that's just my 2 cents. But kudos, ladies. Thank you very much.
Thank you so much.
Thank you, darling.
We still have Ayotola Jagun as well. Would like to say something.
Okay.
Wow. Okay.
Ayotola is in Nigeria, so that's
yes,
good.
I'm in Nigeria.
Yeah.
So I just wanted to say that I belong to a mental health advocacy group. We're based in Nigeria. We're all on WhatsApp. And it's a WhatsApp group. And the aim of the group is to raise awareness of mental health issues. We also have subgroups that focus on different sectors. So we have those who go into the churches and the mosques to raise mental health awareness. We have one for schools, the education subgroup. We have those who go to businesses, the business subgroup. And it's made up of over 150, some are psychologists, some are psychiatrists, some are ordinary busybodies like myself, but, you know, like ordinary citizens who really are passionate about mental health issues. They have also psychotherapists, you know, so a broad range of people. And in fact, it normally is my go-to place whenever I need anything. So recently, my company needed someone to provide specific COVID-19 support for our staff. And I went on the group and I was able to get someone who, actually, I recommended a number of people from the group, but they settled with someone who is based out of the UK, actually, funnily enough. He's a psychiatrist based in the UK, but he has kind of like an employee assistance program in Nigeria. And so his team were able to put something together, and I mean, the company has signed up with him to provide support, because we realize that people being locked down or working from home has its own problems. So there are mental health issues generally, and then there are the things that we're facing today beyond menopause with the COVID-19 that is really heightening incidents of mental wellness issues. I should say mental wellness issues, which is how we prefer to call it, mental wellness. And like you said, it is a spectrum. From stress and anxiety to feeling low, to depression, to schizophrenia, to you know, manic depression, to bipolar. Mental wellness is a spectrum. Mental illness is a spectrum. And so there are, what I wanted to just encourage those in Nigeria is there are resources available, and I'm really looking forward. First of all, well done for this talk. And thankfully, there is no distance virtually. Like I said, there's no distance in the spirit. Thank you for this health talk. I've learned a lot personally from it. I'm really interested in the whole holistic angle of using eating, nutrition, diet, exercise to keep one's mental wellness, your faith and positive confessions. But also, it would be great for you to organize something that's probably more targeted at people who reside in Nigeria. So I'm looking forward to that.
Okay.
Do you mind?
Last person to comment.
Okay, sorry, can I just go? Ayotola?
Yes.
Do you mind please popping contact details for yourself in the chat, Please.
I will, and then I can hook you up with Priscilla, who set up the platform.
Absolutely.
So that, I mean, because I have friends who are all over the world who are members of the platform as well.
Great.
So I can connect you. So I'll put my details on the chat group. Thank you. Thank you.
Thank you.
There is Lola Pachilo on
that's Ayatollah. No, it was Kathy that mentioned about the mental health first aid training in the States. Now the lady that's about to come on, Lola Pachico, she trains people for the mental health first aiders. Welcome, Miss Pachico.
Awesome. Well done. It's amazing work. I'm so excited by it. I was listening to Kathy and I could identify with everything she was saying, including the mental health first aid, because it was rolled out very recently in the UK too.
Yes, because I had the other one.
Schools. And like, as she said, the everyday person, there was something about us trying to bring parity between mental health and physical health. It was understood within the government that actually there was a lot of priority given to physical health, and there was a lot of importance attached to physical health that wasn't attached to mental health. In my service, we look at it and look at the concept of mental health and well-being, and that's the language that we use for it. It was very interesting to listen to all the different views about it. I think that this is the start to the conversation, and that it's really important for all of us to see how much we can gather together to put this information more out there in our Nigerian community. I think that at present, I know that there are quite a few people that have started to get involved and get the dialogue going. But I also think that there's lots of things that we have learned in America, in the UK, and wherever we may be, that we can use to put together more information. I think that as we've had the COVID, it's actually allowed us to start to utilize a very different way of working. And I think if COVID didn't happen, we won't even start to have these kind of big forums. I think it's really important that we start to look at this forums like this and look at how we can replicate it in Nigeria even more, so that we can get the dialogue going and we can use psychoeducation to break some of the stereotypes and the stigmas, because mental health, mental illness doesn't all have to end up in Arrow. There's something about the early interventions, the psychoeducation, the education of everybody that actually can help us keep the conversation going. And it might mean that people don't end up getting to the extremes that we sometimes see in Nigeria. But thank you, ladies. And that's my 10 cents.
Thank you.
Thank you.
That's it.
Okay.
No more.
Okay, brilliant. So last word from me, then Pastor Mobs will just do her final word. I mean, this is our underpinning scripture in Vibrant Midlife. 3 John 1:2. It is God's intention that we prosper and that we are in good health, even as our soul prospers. My sisters, I am pleading, I am begging, please cooperate with God for yourself, for your loved ones. Love yourself enough to look after your body, to look after your mind, to live a healthy lifestyle. The time for a healthy lifestyle, there's no better time than now. Evaluate where you are. It's small steps, it's a journey, it's not a destination. And what you're looking at is wellness, 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 wellness. If you need help, please reach out. And please, please, please watch out for our next talk. I'm hoping to get a specialist GP, menopause care GP, who will come and talk to us about HRT and burst those cancer myths as well. I'll say finally, thank you, and then hand over to Pastor Mobs. Pastor Mobs.
Hello again, everybody. Thank you very much. This has been a great session, very, very, very educational. I have learned more things and I'm very grateful. Dr. Yetty, thank you so much. Liz, thank you so much. We're so grateful. Thank you, and God bless you. And we hope that for all that we've learned today, we'll be able to carry it and do something about it, especially watching our diet and our ways and, you know, our mental health. The Lord will help us.
Pastor Mops,
Ma.
one moment. I've just seen your message. Miss D wants to say something.
No, that's okay now. It's okay. It's okay.
Are you sure?
Yeah.
Okay, cool. All right. Please carry on.
It's okay. I just want to pray that for all of us and many others that are not here, that we're going to be having a good lookout for as our neighbors, that God will give us the strength, the ability to do what is right to our body, to take care of what God has given us, to be able to handle things in a positive way in Jesus' name. And that as we go about learning how to manage our lives, we would have the strength, the ability, the fortitude to do it well in Jesus' name. Many of us are mothers here, and I pray that nobody will take our position in the day of our joy in Jesus' name. Even as we round up, I don't know if there's anything else you want me to, is there anything else before I round up?
No, that's it.
So it's just to say good night, everybody, and God be with us all in Jesus Christ's name.
Amen.
Amen.
Thank you. Thank you, everybody.
Thank you, Dr. Iriah. Thank you so much,
everybody.
Sisters, for logging on and spending your time with us. It's been amazing. Thank you everybody. so much.
Thank you so much, Cookie. Thank you so much, everybody.
Thank you.
Thanks, everyone.
Thank you, everybody. Have a good weekend.
Thank you so much.
Cookie, can we stop sharing so we can see people?
Sorry,
Thank
you.
Thank you and good night.
Thank you,
everybody.
I love you.
Good to see everybody.
Very much appreciated. Bye.
Bye. I love you. We don't.
Zainab.
Yes, I love you.
Love you too. Bye.
Bye. Thank you so much. Thank you.
Oluba, thank you for joining, ladies.
Yeah, thank you, Olubo.
USA was a good sport, Liz. The USA.
I know, right?
Yes.
Love you all.
Holy Child girls who joined.
Yes, so great HC. Thank you, my babe.
I didn't know you went to HC, Liz.
Holy Child College, babe. Anytime, any day.
I had no idea.
That's all these ladies you are seeing from the States are my HC people now.
Wow, amazing.
Yeah, so, and Ayatollah as well from Nigeria.
Oh, wow.
Oh, yeah.
Florence, you had a lot of HC.
Oh, yeah. There's Florence Wumpa there.
Oh,
yes.
wow. Thank you so much, ladies. It's been amazing. Thank you.
Thank you, guys. Thank you so much.
Have a blessed
night, ladies.
Okay.
I see Yetunde Martins right there.
Yes.
Minima was
Pali one.
My best store is HCCO.
Minima Uko.
Oh, Bonne is your friend.
Bonne is my best friend. Yeah, she's one of my best friends.
It's a small world, huh?
I don't think HC girls are unique. HC girls are very unique.
I don't know about that, but
long-lasting friendships, darling. Long-lasting.
Yeah, so
we have those
we
two.
Keep it going. Oh wow. Awesome.
Thank you so much. Good to see you.
Eloquent event management.
Have a blessed one. Great to see you. Well done. Great presentation.
Well done. You did amazing. Dr. Iriah,
thank you.
lastminute.com, but you delivered. We thank you.
She pulled it off for us. Nice.
Thank you. Catch you later.
Bye. Bye.
Well done, Liz. Okay.
Thank you.
Take care.
Thank you.
There's Minima there, Buki.
Yes, I can see her. Yeah, she's thumbs up in. Yeah.
Olufunke, I see you.
I sight you there.
Thank you, babe. Thank you, darling.
You're welcome. You're welcome. Well done.
Thank you.
Good
thank
chat.
you. Thank you.
Minima Uko, childhood friend. It's good to see you.
Oh, wow.
Okay.
All right.
Thank you, everyone.
So
take care.
Shall we leave the meeting now?
Yeah.
Let me stop recording.
Yeah. Bye, everybody.
Bye.
Good night. God bless.
Yeah.
Good night.
Bye. everybody. Love you.